make everything that's required to go into war. So what that created was a need for employment, or a need for workers. And what happened was the government said, well, we're going to price cap what you can pay employees. So employers got creative. They want to attract good employees and retain skilled labor. They started offering benefits. They started offering were health benefits. So that was a landmark time when now employers got pulled into offering other benefits, i.e. health care, in order to retain employees, because there was a price control on wages. So that was a landmark time. So going into the 1950s, now we're seeing more expenditures on healthcare. Not because now there's more technology being used in healthcare. Penicillin wasn't invented in 1940, it was invented in the 1800s sometime. But what happened during the war is a company called Pfizer found a way to take penicillin and mass produce it in a significant amount of quantity. It was the perfect time because it was the first time now that we can actually fight infection for our soldiers. So prior to that, soldiers had to suffer, and there were a lot of infections. So we were the only country equipped to protect our soldiers from any kind of infection and death. So that was now more technology. In the 1950s, we're seeing now more need for healthcare. So 4.5% of the GNP back in the 1950s was spent on healthcare. Nothing like the 60% today, but now we're starting to see more expenditures on healthcare. Expansion of federal programs. Now we're starting to see the federal government take a role in helping the sick poor. That's going to lead to Medicare and Medicaid. More medications were developed. We found a cure for polio. So prior to that, as you guys know, millions of people died. Prior to that, millions of people died from other diseases also, like smallpox, etc. What we're going to find out is that technology is going to lead to demand, which is going to lead to more cost. First, organ transplant was discovered in the 1950s as well. So again, new technologies. Medicare and Medicaid signed into law in 1963. And at the same time, what that created was now a new payment mechanism, a new reimbursement mechanism for doctors. Prior to Medicare and Medicaid, doctors were paid on a fee-for-service basis. So you remember that? Just going to the doctor and you're paid for the service. You pay for the service as you go. Well, Medicare and Medicaid created a new reimbursement channel for doctors, where now the government was paying for health care. So now they had a whole new revenue stream. Medicare is basically those that are 65 and older have the government fund their health care. Statewide, Medicaid takes care of health care for the poor. So you have federal and state health care programs. And now created more revenue for doctors. And what that did was now open up doctors to figure out, well, how can I make more money? And where can I specialize? So more subspecialties like evolve, cardiology, nephrology, neurology, OBGs. Now they were paid even more money to do. So incentives were created for doctors to not only do family practice or internal medicine, but now to specialize in care. Obviously, as a result, when you see a cardiologist or a subspecialist, that's more expensive. So now we're seeing more cost. Well, employers saw costs for healthcare start to increase as well. And what happened in the 1970s to react to the ever-increasing costs, they felt that they needed to control healthcare, what was called a health maintenance organization. So to allow states to set up HMOs so that they can offer healthcare, but at a reduced cost, because now they're managing care. So managed care evolved, and what that meant was managed care is limiting access and limiting utilization as well. So limiting access is basically, well, let's create a network of doctors, we'll cherry pick who we want in this network, and let's also cherry pick the services that we want to offer. So if you're going to be a member of our HMO, you can only go to these doctors, and you can only have these services paid for. So we all felt those pains back in the 70s and 80s when the HMO started, but it was a way for employers to get their hands around cost and offer it at a reasonable price. I talked about smallpox earlier. With the advent of drugs, by the 1970s, smallpox was eradicated. Prior to that, millions and millions of people globally died from smallpox. But now we're seeing more social programs, Medicare, Medicaid is growing. By the 80s, another payment method started. It was called capitation. Capitation means basically putting a cap, a ceiling on how much you get paid. So doctors are paid on this capitation basis through the HMO, where they're paid on a per member, per month basis. Fixed rate. So every individual in here was a head that the doctor would have in his membership, and he would get paid every month for every member. So that was a great idea for the doctor. Like, wow, I'm going to get paid a lot of money. The more people I have, So now what we're seeing now is doctors reduce their time spent with individuals. And I think you guys have seen that. The advent of the HMO, you saw also the advent of less time spent one-on-one with your doctor. No longer that fee-for-service payment was now a fixed payment, and the doctors had a limited amount of time to see it. Not only are we paying more for healthcare, now we're getting less out of it. Corporations, they began to fight back with high-cost healthcare. Now they started buying hospitals, they started buying physician practices. They thought, well, if I'm efficient at running a business, I can do the same thing running healthcare. They're actually backwards. It did not work well. So they got out of getting into healthcare. By the 1990s, healthcare costs were starting to go significant. Healthcare costs were doubling the rate of inflation. By the end of the 1990s, 44 million people were insured. Today we have 47 million. More diseases developed. HIV started in the early 1990s. By in the late 80s, by 1990, 140,000 people had AIDS. And out of that 140,000, 60% will die from that. With the advent of drugs, obviously now more people are living with HIV. So again, more technology. Many of you have probably seen articles on Medicare and the state of Medicare today. It's a sad state, and a lot of people are predicting that in 20 years we will not have any money left over in Medicare to provide care for those that are 65 and older at that time. Employers are significantly under cost pressure. We're seeing GM shut down plants because they just can't afford health care. We're seeing a shift to more deductibles in terms of how we're paying for benefits. We're also seeing more direct-to-consumer ads by pharmaceutical companies because they're no longer being able to sell to physicians. They can sell directly to the end users, the patients. So obviously we have a very important election coming up here. There's a lot of healthcare discussions. I think the top three issues are obviously the war, the economy, and healthcare for all both candidates. So the question remains, what's going to happen? What's the future of healthcare? Which model are we going to go to? Are we going to go to the right model? Are we going to go to the left model? Which model are we going to be? How is our employers going to continue paying for healthcare? Are we going to shoulder the burden for healthcare? Is the government going to shoulder the burden for healthcare? All big questions. What are we going to do about the uninsured? What are we going to do about the elderly? What are we going to do about the poor? A lot of big questions there. The bottom line is that we are now shouldering the burden for healthcare responsibility and shouldering that burden for our family and also for our parents as caregivers. So if you think about your dollar you spend on your healthcare premium every month, where does that go? Here's a breakout of the premium dollar, and about 86% of your dollar goes towards physician services, outpatient services, hospital services, 15 cents on the dollar goes towards prescription drugs, 10% to what I call inefficiencies in the healthcare system, which is medical liability and defensive medicine. What we're seeing more and more are lawsuits. And lawsuits drive up the cost of healthcare because now physicians now have to pay more out of their insurance for their medical liability. Physicians are going to be doing more tests to prevent themselves from getting exposed to liability. We're seeing 5% of other service, DME is durable medical equipment, just wheelchairs, crutches, etc. Well, if you look at this dollar picture, it's very reactive in terms of what we spend money on. We're spending money when we diagnose and when we treat. We don't ever spend enough money on prevention. So less than 5 cents is spent on prevention, disease management, care for the patient. If you think about that, we engage ourselves in prevention all the time. When we get in our car, we put on our seatbelt. When our kids get on their bikes, they put on their helmets. If we go on our construction site, we're wearing construction glasses, we're wearing construction helmets. We really engage in enough prevention in healthcare, and studies show that obviously there's an ounce of prevention is the common cure, but you can reduce the risk of chronic diseases through active prevention. So yes, we are exposed to a lot of things which this guy down there, the burger period is that. So obviously we're exposed to a lot of things which actually prohibit us from living healthy lives, but it's up to us to make the right decision in terms of how we want to drive prevention, drive wellness to prevent those chronic diseases. And it can happen. So